Hello everyone, I am Aditya Raj and I work at Multitel Innovation Center in south of Belgium in Mons, and today we are going to talk about blockchain in healthcare. It has been done in the context of Blockstart project, because Blockstart project is dealing with three different sectors, which is healthcare, agro-food and logistics. Blockstart helps SMEs from Northwest Europe, if they are belonging to these three sectors, to understand, adopt and implement blockchain. So if after this talk any of you SMEs out there is getting inspired or getting some ideas that yes, they can do this, then come to us, apply for the Blockstart project, and we will take it from there. So the agenda for today is I'll be talking a little bit about the general impact of blockchain. Then we'll be digging deeper into healthcare sector. We'll discuss about the challenges in healthcare sector, then how blockchain can tackle some of those challenges, and then we'll discuss some of the use cases and see, one on one, how what the problem is and how blockchain can solve those problems. And we'll take one of the big use case, like, which is very kind of very important right now, which is a vaccine, COVID vaccine supply. So I thought, why not make this use case and discuss about this and how blockchain can help on the traceability and the distribution of this COVID vaccine, which is very essential. So that by that we'll end the talk, and at the end you will have you can see my LinkedIn QR code, and if you want to connect, you can connect with me. So not wasting any further time, I'd like to share my screen, and we'll take it from there. And so let's get started, and let me share my screen. Okay. So blockchain in healthcare. So that's the topic of today. I'm Aditya Raj, DLT Blockchain Innovation Lead at Multitel Innovation Center, which is in south of Belgium in a city called Mons. National health spending in US is in trillions and increasing at a rate of 5 to 6% each year, and it will reach around 6 trillion in 2027, which is like 20% of the GDP. And if we compare with Europe, almost 10% of the GDP of most developed nations goes into the healthcare spending. It is this wasteful healthcare spending that we need to save, and there lies the business opportunity, which is in billions of dollars, in fact trillion. So there is a huge amount of value that needs to be captured, and that's why I wanted to bring your attention to. So the problem, 20% of the healthcare spending that I just talked about in 6 trillion is wasteful spending. And the waste lies in the failure of care delivery, failure of care coordination, low value care, fraud and abuse, and administrative complexities. And if you count around 25% of 6 trillion, it's around 1.5 trillion. So it's astounding, and we can do something to save most of this wasteful spending. So let's see. I just want to bring on the positive note where we stand. So this is the study done by McKinsey, and I just wanted to point out Blockstart project is focusing on these three sectors, and healthcare is lying in the middle of this impact and feasibility curve. So it can really be pushed towards the top right corner very easily, and the trends are showing that it's going in the right direction. Another study done by Databricks shows that by 2017, it was only 15% that commercial deployment was being done, but now it has moved from 15 to 55%, and not sure, no plans has been reduced from 50% to 6% by 2025. So let's talk about the current challenges in healthcare system. I have divided it into three different verticals: healthcare fraud, healthcare inefficiencies, and healthcare data privacy. When I talk about fraud, I'm referring to the medical billing fraud, drug counterfeit, clinical trial, misreporting, illegal referrals, consumer deception fraud. When I talk about inefficiencies, I am talking about unnecessary admin costs, data interoperability, duplication of efforts, drug price variance. When I'm talking about data privacy, it's all I'm referring to cybersecurity, data ownership, monetization, and digital identity management. So these are some of the challenges where we can get help from blockchain to solve some of these issues, like interoperability. Like once we have every data, the transactions on the blockchain, everyone will be talking in the same language, so they can interoperate. Simply put, data integrity, because of the immutability part, nobody can tamper the data, so the integrity is kind of maintained. Security is inbuilt because it's every transaction is cryptographically hashed, and there is a public private key mechanism, so it's kind of secure. Maintenance cost, because of removal of intermediaries and smart contract, you reduce a lot of capex and opex, so there's a less maintenance cost. And universal access, of course, the blockchain is kind of depending on the public private which one you use, but still, like, the access is kind of given to all those who has the right to access the blockchain, so it's available 24/7 to whosoever is authorized to see the data. So let's discuss some of the use cases in blockchain that I have thought for today. So first one is drug authenticity and traceability. As it is a very big topic, and I chose this because it's kind of transversal. It's kind of touches many different sectors, because supply chain is not just only in pharma. It's a use case that is applicable in many different sectors. So the problem is 30% of the drugs are fake, and that leads to $200 billion of waste every year, according to World Health Organization. And what can we do about it? So what the traceability part, if you remember, blockchain is immutable and it has all the record time stamped on a ledger. So you can do the audit trail. You can know the provenance of where the drug is coming from. So these aspects of being secure and being traceable and immutable allows the drug, it forbids people from, counterfeiting or faking it. So it's really a very nice use case where blockchain can really help in traceability and knowing the provenance of any product, in this case, any drug. Clinical trial. The next big problem I saw was worth mentioning is, like, most of the studies, like only 16% of the people know what is happening. If there is some study going on that can be of help to them, so that means approximately 85% of the patient has no idea that any valuable clinical trial were in operation, or that they could have benefited from a treatment that the trials offered. To think that so much money and time is spent on developing a drug and almost none is spent on finding patients for clinical trial is astounding, and that the public could be made more aware of it. So blockchain technology will be able to directly increase the quantity and quality of patients recruited for clinical trial in a number of ways. This type of distributed ledger could allow individual patients to store their medical data on anonymously, thereby making it visible to trial recruiters. And then they can reach out to the patients if their data qualifies for the clinical trial. It could also streamline the communication between doctors and patients during the trial. Blockchain has the tool to provide smart contracts that endorse transparency and traceability over clinical trial sequences. And that can provide financial incentive for a patient participation and sharing of their data. So this is a very nice use case where it can help in clinical trial. The next is health record management. This is also a very surprising fact that 30 billion transactions happen every year, healthcare transaction, and out of those 15 billion are fax. It's old methods of transacting and data transfer, which is huge, and it costs 250 billion every year. I think you all know that this can be totally taken care of using digital methods and using blockchain, putting data and transacting data on a chain in a digital way, so that you can remove many of those transactions, I think. So that will reduce a lot of cost. It is a chilling reality. Everyone overlooks the annual mortality statistics, but 400,000 people die every year because of the mistakes, like medical error, like as I'm talking about the mistakes in administrative mistakes. 75% of the health data breaches in the last 7 years were due to hacking. I would also like to focus on bring your attention to these kind of administrative errors or medical errors that is causing 400,000 people dying every year, and this makes it number third killer after cancer and heart disease in US. That is crazy. So so these kind of data breaches and administrative errors, all this can be really, if you think about it, it's very easy to remove or mitigate these kind of errors, problems, risk by using blockchain, because what blockchain with a smart contract, they can really automate processes and remove intermediaries. So these kind of manual tasks of data entry or administrative mistakes cannot happen, and the data breach problem can be resolved by access control, which you all know that blockchain provides you access based on authorization and cryptographically secure public-private key. So and we can also boost it with the IoT and AI, so that people can really take informed and intelligent decisions, and some of the processes can be made intelligent and automated with the help of IoT and blockchain, IoT and AI. So let's talk about drug authenticity and traceability. Let's talk about one of the use cases. I thought, what better than talking about COVID vaccine? 7 billion people will need this COVID vaccine. And I'm talking about the first dose. So there are two doses. So that makes it 14 billion. And according to WHO, World Health Organization, indicative vaccine wastage rate is 30%. That means if you calculate back, we need around 19 to 20 billion vaccines. That's insane. I think I don't know in my capacity, like when did we require that kind of scale of something 20 billion doses. So that's insane. And the amount of syringe needed to give those vaccine, the healthcare providers needed to give those vaccine, that is another level of discussion. And if you see the third vertical, 3 to 6 billion is lost, is the cost of wastage globally. It's coming from World Economic Forum. So cold storage, cold chain logistics, in general, mostly the cold chain works like between 2 to 8 degrees Celsius. And here we are talking about, like, let's take example of Pfizer and Moderna. It's minus 20 degrees Celsius and minus 70, which is like another constraint, another bottleneck for the cold chain. So let's see how it will look like when we talk about a drug supply, and you can imagine COVID vaccine here. So I have made a timeline. The sequential way it will work is, you will have why reinvent the wheel. So let's take the legacy supply chain, which uses GS1 standards, GS1 EPCIS standard, that enables trading partners to share information about the physical movement and status of a product as they travel throughout the supply chain from business to business and ultimately to consumers. It helps answers the question. To those who don't know, I just wanted to recap that APCIS helps answer the question like what, where, when, and why, to meet consumers and regulatory demands for accurate and detailed product information. So we take that kind of GS1 APCIS standard and put it on blockchain. So right from the manufacturer to every transaction being taking place, along with the IoT data, like you see, temperature, the location data, the time between point A to B, and if there was any kind of things that you need to put an additional information system. All this can be coupled together and put on the blockchain, because this is small. But if you have other files or big data involved, like the paperwork or some images or some documents, then that can be stored off chain. But these barcode and all this simple information regarding temperature and sensor data, all this can be put on a blockchain, and the documents can be hashed, and their reference can be put on blockchain, and the documents can be referred to using those hashes. And every time it passes through the supply chain, the data is recorded and put on the immutable ledger. And that way, when it reaches the end customer or a hospital or pharmacy, they can backtrack, and like, you have the whole audit trail, you have the provenance. Anyone at a particular time who wants to verify the past, where it has been and what has happened, they can do that using this technology. So what will that do? That will result in, like, these are the four parties who will be involved, and they can manufacturer can proactively monitor for adverse events and improve recall management. Distributors can gain real-time visibility and enhance ability to respond to supply chain disruption, and dispensers can improve inventory management and safety monitoring. Citizens can trust the vaccine, and they can go back to society. So if I have to end this talk, I will end it on this note that if you're looking for cost reduction, fraud mitigation, efficiency improvement, I think these are the broad three that anyone looks for, and that makes the whole business really interesting and successful. Then the blockchain is the intersection of all these three, and that is the horizontal innovation that healthcare needs, and that is the innovation that you all are looking for. And if you're listening to this talk, that's it from my side, and thank you very much. I'll stop sharing my screen, and yeah, so thank you.